Hi, this is Dr. Robert Norman. Glad you're here. This is the Brain-Skin Connection series, The Outer Brain, the Incredible Power of the Brain-Skin Connection. This is from the Norman Center for Neurodermatology. We're investigating the interactions between the brain and the skin in relationship to disorders such as melanoma, Alzheimer's disease, Parkinson's disease, autism, neurodermatitis, and other neurocutaneous diseases. What is our goal here is to translate skin-brain research into effective behavioral strategies that prevent disease, promote healing, provide treatments, and enhance well-being across the lifespan. Hi, what we're working on today is in what ways does the skin reveal brain changes? Perhaps the most important skin signs are seen with neuropsychiatric addiction and itch disorders. Psychiatric disorders are central nervous system conditions with a neurobiological basis. They generally involve disturbances of emotion, cognition, motivation, and socialization. Psychiatric disorders can either lead to psychocutaneous, which are skin manifestations, as a consequence, or they may arise as a result of a chronic dermatological condition that impacts on the patient's mental health. What can be done about these troubling maladies? So we do have treatments for things such as neurodermatitis. It's a multifocal treatment. It can include topical and systemic steroids to decrease the itching and redness of the affected areas. But we also decrease depression and any other psychological ailments if present. Included would be counseling for successful cessation of scratching. What about drug abuse? That can wreak havoc on many of the body's organs. Alcohol abuse puts tremendous strain on the liver. Cocaine can significantly stress the heart and the skin, and heroin can damage the kidneys. That damage can remain hidden for many years since it is impossible to see the harm, sometimes without sophisticated medical imaging systems, although we can see it dramatically on the skin, as I will show. So abusing a wide range of drugs over a period of time can cause a variety of infections, sores, and severe inflammation of the skin. The damage is because of four factors primarily, or a combination of these factors. The drug itself, impurities used to cut the drug, or that make their way into drugs sold on the street, how the drug is delivered, for example, IV or snorting it, unhealthy behaviors that lead to skin problems, such as poor diet, lack of sufficient sleep, and failure to maintain adequate personal hygiene. So the most common skin problems associated with amphetamine use, for example, is formication. This is an hallucination that causes people to feel as if there are bugs crawling under the skin. These bugs aren't real, but they only exist in the user's mind. It does not stop someone under the influence of the drug from scratching and picking at their skin, digging for what are known as meth mites. The scratching can create open sores and scabs. Meth sores look like ulcers and open wounds. The experience of hallucinating meth mites is caused by a surge of serotonin in the brain, which can lead to a psychotic episode. There's another problem called dermatotillomania. That's a mental disorder that involves body-focused repetitive behavior, in this case picking the skin. While this is officially classified as a mental health issue driven by obsession and compulsion, many people who use meth develop dermatotillomania during periods of prolonged use. The individual who suffers from this condition feels powerless to stop the behavior, even though it causes physical injury by obsessive and compulsive picking of the skin. The most targeted area is the face, although some users will also pick on the arms, legs, back, stomach, and chest. So in review, formication is the sensation of feeling bugs under the skin, and dermatotillomania is the need to pick at the meth sores caused by digging into or scratching the skin to get the bugs. So recently we had a patient that presented with purple ears. The edges of his ears were quite dramatically purple. At first he denied any drug use and then admitted that he'd been on crack cocaine on and off for about 10 years. All the features of this were consistent with what's called levamisole toxicity. According to the CDC, about 70% of the cocaine supply in the United States is adulterated with levamisole, which is being cut into the cocaine before it is smuggled into the United States. It's currently used as an anti-helminthic medication in the veterinary field, basically to anti-worm. And why is this added to the cocaine? It's thought to increase the total weight of the cocaine due to its physical similarity to cocaine. And it prolongs a cocaine-induced euphoria by potentiating the nicotinic acetylcholinergic effects. Now, although levamistil is a more expensive additive agent, the major attraction is that it can be used as a cocaine adulterant, and is reported that levamistil tainted cocaine passes the street test, which is known as a bleach test, which is used to detect impurities in the cocaine. Let's talk about prurigo nodularis. That's a non-contagious skin disease that usually begins with intensely itchy skin. Scratching and rubbing the skin can cause hard, itchy, burning skin and bumps. Several studies have been launched to find ways to quiet the discomfort of prurigo nodularis. There's a new one by Kiniksa Pharmaceuticals to investigate the efficacy and safety of one of their trial drugs. And many cases of PN or prurigo nodularis are associated with depression, and perhaps utilizing psychiatric interventions with new injectable treatments might provide relief. We also usually provide topical medicines to cut the itch and the irritation, and recommend, if it gets severe, to get counseling and consider other alternatives. And what about delusions of parasitosis? This is a somatic type of delusional disorder. It's usually monosymptomatic, in which the patients are convinced they are being infested with animal parasites, although there's no objective evidence that exists to support this belief. The complaints are usually about skin infestation, and numerous samples are brought for examination from skin, clothes, and environmental sources. Sometimes they bring in a matchbox or a container or a bottle full of all kinds of different specimens that they've gathered on their own. And then they'll give a detailed prescription of the parasite and explain where it lives and how they got it, or how they believe they got it. Now, in primary delusions of parasitosis, it arises spontaneously as a monodelusional disorder. In secondary, it rises secondary to another major medical, neurological, or psychiatric disorder. Many of the patients definitely refuse any psychiatric help, and there's a shared psychotic disorder, a folie à deux, which is a known mode of presentation in delusional parasitosis, which I've seen actually on several occasions where, for example, a spouse brings in their partner, and then they also describe that they have this also. And this, in this case, of course, more than one member within a family experiences the same delusional state. So pruritus, or itch, starts with an external stimuli. It could be dust or touch or a mosquito landing on your arm, and is a built-in defense mechanism that alerts your body and your brain to the potential of being harmed. If the stimuli goes over the threshold when it scratches your skin surface area, dermal skin receptors will send an immediate signal through fibers in the skin to your spinal cord, up to the cerebral cortex and into your brain, that tells you to scratch. You may feel some relief when this itch response is temporarily interrupted, but a persistent itch may result in a chronic itch-scratch-itch cycle. It's one of the most common reasons for visits to physicians, especially to dermatologists. And many times the itch is the only symptom, but often it's related to eczema, psoriasis, or other skin diseases, and also neurodermatitis, which I mentioned earlier. The term itch has evolved into many connotations in our society. Researchers have found that songs get stuck in our head because they create a brain itch or a cognitive itch, which is analogous to histamines that make our brain itch and can only be scratched by repeating the tune over and over. For example, "Who Let the Dogs Out" is the oral equivalent of a skin itch that can drive you crazy. In the next talk, I will explore what are the connections between touch, sight, hearing, and mental health.